Well, hello there, and welcome to another edition of Johnny Davis live here on this Friday, February 21st, 2020. Boy, do we have a great conversation for you today with the one and the only Dr. Jon Lucas, who is a pediatric cardiologist and a fight doctor here in this region, one of the best in the business, no doubt about that. So we're looking forward to having a long conversation with him. It was so interesting. We were talking the other night. He said, "Yeah, I'm looking forward to that 18-hour and whatever." But the idea of it is I have so many questions. You know, one of my things about health and fitness is that I've always been into it, you know. So to have access to Dr. Lucas and to be able to have him on the show and ask him a million questions, right? It's so much fun. But I know that it's very, very educational for you as well, fighters and just the general public, you know. So if you don't have time to watch this entire show today, I hope that you certainly will join us a little bit later and check it out, you know, on a broadcast. I want to also thank our sponsors, Blackout of Fight Gear, blackoutfights.com, for all they do for us. You can check them out on our website at akpromotions.org, or theirs, of course, at blackoutfights.com. Also, Eastern Offset Printing out of Atlantic Beach, North Carolina, for all of our printing needs, whatever it might be, brochures, flyers, posters, they have it for you. Eastern Offset Printing in Myrtle Beach, South Carolina. If there's other people out there who are not like our current sponsors who want to come on board and sponsor our show, feel free to give us a call. All of our information is on our website at akpromotions.org. We have a lot of events coming up this weekend, and really throughout the year, we're going to have a fantastic year. But on tomorrow, we'll be in two locations, one in Apex, North Carolina. Registration will start at the door at 10 a.m. in Apex, North Carolina, at the Apex Martial Arts Center there with Mr. Don Roger, who will also be promoting his Triangle Kickboxing Promotion show on next Friday there in Durham, North Carolina. It's a really exciting event. But tomorrow, we're in Apex. A lot of pre-registered fighters already. It's going to be an awesome event. You can show up at the door at 10 a.m. Also on tomorrow in Sacramento, California, our rep over there, Ryan Hodges, Jackie Hodges, and Daniel Hodges, my son Richardson Davis, all of them will be there at the expo, at the Cal Expo there in Sacramento, California. They already have like 140 registered fighters. I mean, so we're going to have a great event over there. IKEA PKB, IKEA Point Muay Thai happening there in Sacramento on tomorrow. So you guys definitely want to check that out. Another big thing, obviously, that's happening right now, registration is going strong, really strong, for our IKF Spring Classic. It's going to be a great event, guys. Want you to make sure that you go ahead and get registered. We have, I'm thinking probably 120 some fighters right now that's already registered, with a lot more coming on board. Remember, those in single registrations right now, those in single brackets, those divisions will start to condense down starting Monday. They will be, or after Monday, they'll be able to move into brackets where they're fighters. So you're going to see a big condensing of the bracket starting on this Monday. So you want to check out all of our registered fighters at akpromotions.org. Just go to the events calendar and you'll be able to check out all the fighters that are registered and all of those exciting divisions there that are waiting for you, men, women, and juniors. This is full contact action, knockout in a ring. You win nice belts and nice cups and nice medals. It's a great event, guys. March 20th and 21st in Myrtle Beach, South Carolina at the Crown Reef Conference Center. Yes, we will also have the IKF Point Muay Thai and Kickboxing Sparring Tournament there, and the PBSC Sparring Tournament as well. Those of you who need to go ahead and register your and book your rooms, you want to go ahead and do that as well. Do it ASAP at the Crown Reef Conference Center. That information is also on our website at akpromotions.org. All right, guys, without any further ado, we want to go ahead and bring up the man himself. He is a pediatric cardiologist, and he is, I would say, one of the most profound people that you ever want to talk to. I mean, the guy has so much information. He's a fun guy to talk to. He has a lot of information, a lot of knowledge that is going to help you be for the better. Ladies and gentlemen, introducing none other than Dr. Jon Lucas. How are you, sir?
Good. How are you doing, Johnny?
I'm doing just fine, doing just fine. So happy to have you on today. We have a lot to talk about today when we talk about matters of the heart, right? I was very intrigued by the idea of having this conversation with you, and I'll be right back there in a second. But I was intrigued in having this conversation with you about the heart because it's something that I think a lot of people need the information on. If they don't have that information, they certainly will be intrigued by all the stuff we're going to share today. And I realized I went out there just for a second. I was checking out something else, But I think that first of all, just kind of give us a general idea about why the heart is so important. I kind of know, right? But why is it such an important organ in our body?
Yeah, so I mean, the heart's basically just a big fancy muscle that works like a pump, and it has the responsibility of pumping blood throughout your entire body. But unlike all the other muscles in your body, it can't ever take a break. You can't like shut your heart off for an hour here or there for it to be able to rest. So it works 24 hours a day, 7 days a week, from before you're born until the day you die. And if there's ever any significant alteration in its function, that can very easily be fatal. So it performs a very important function, and there's no way to like take a break from doing it. So it has to be perfect all the time.
Yeah, when you say that, and this is kind of jumping ahead on my questions right here, but it just makes me wonder because I think about in ancient times, they used to talk about that the brain, that the heart was the most important thing. Matter of fact, you thought with it almost. It was like more important than the brain. Um, what do you think about that? I have a theory because, when I thought about it more in depth, I thought about the idea that you can live without brain function, but you can't live without heart function. Correct?
Yeah, I guess that's sort of true. Although, I mean, it sort of depends on your definition of live. We jokingly, we all know some people who we would suspect don't own a brain by some of the things that come out of their mouth. But when you truly have a cessation of brain function and you're quote unquote brain dead, like you have to be in order to be an organ donor, I think most people would argue it's not really alive. That would have no idea. They're not having any cognitive thought. So, the question of what's more important, the brain or the heart, it'd be kind of like asking a mechanic, what's more important, my engine or my transmission? Your car's
Right.
not going anywhere without either one of them. So I think that they're, kind of equally important. It's hard to put them in some sort of rank order. As a cardiologist, of course, I lean towards the heart being pretty important, but I'm glad I have both, and you would be
Yeah. Yeah.
sorely
Yeah.
disappointed if either one of them ever stopped functioning.
Right. Right. Well, it's just kind of just been one of my observations. Here's a kind of lighter question. Can a person die from a broken heart? Before we get
So,
into the really meat and potatoes, but can a person actually die from a broken heart?
so the short answer to that question is actually yes. There's
Oh,
actually a disease or a syndrome. It's was named by a physician in Japan after a vessel they use for catching octopus, but it's called Takotsubo cardiomyopathy, or
wow.
pejoratively broken heart syndrome, and it's been well described. And it typically occurs in people that had some sort of major emotional trauma. So it can come from breakup of a relationship, losing a job, a sudden financial loss, just plain stress. But it's actually a demonstrable. I mean, you can actually look at the heart and see it. The left ventricle typically enlarges a little bit in size and doesn't function correctly. So, I mean, they actually develop myopathy or a dysfunction of their heart muscle as a result of that. They don't know exactly what causes that to happen. It's
Wow.
probably a reaction to excessive stress hormones, but it's a real thing.
Right.
Now
That
that
was kind of a lighthearted kind of question, but I guess it's pretty serious.
Yeah, it can be. That's not super common. I don't recall ever hearing of that condition until probably 10 years ago when I was already a cardiologist. So it's not something that's super common, but I mean it definitely does occur. And if you talk to particularly adult cardiologists, almost everybody knows of someone in their practice who took care of somebody who ended up having that. And the majority of people who get that condition end up surviving. It's not typically fatal, but it's a real thing. The quote unquote broken heart syndrome can actually happen.
So we need to kind of watch how and who we love and what's going on, because it can actually really kill us.
Mostly for psychological reasons. You don't want to be mean to folks, but yeah, there actually are some people that have demonstrable cardiac dysfunction after emotional stress.
Wow, guys. Okay, guys. So watch that heart thing. Watch who you out there loving, all, because we don't want you to leave us and everything. There is So let's get down into the technicality of what the heart is all about. When the heart pumps blood, right? What is the actual process, and why is that so important? The pumping of the blood.
So the normal heart, it's actually two pumps that are set up in series. So blood comes back from your body without oxygen in it, and it comes to the right side of the heart, where it goes into it ends up going through the right atrium, which kind of collects it and goes into the right ventricle, which is the first real strong pump of the heart. And then that right ventricle pumps it out to the lungs, and that's where gas exchange takes place. So the blood picks up oxygen, and then that newly oxygenated blood comes back to the left side of the heart, into the left atrium, goes into the left ventricle, which is the strongest pumping chamber of the heart. And then that left ventricle pumps that oxygenated blood out to the body. And then that blood just keeps going through that same cycle. It goes to the body, delivers oxygen to the tissues, comes back to the right side of the heart, gets pumped out to the lungs, picks up oxygen, comes back to the left side of the heart, gets pumped back out to the body to deliver, and just keeps going.
Wow. So there is a deoxygenating and oxygenating process of that. That brought me to a question. I want to ask you about the difference between deoxygenated blood and oxygenated blood. First of all, let me ask that. What is the difference?
So your blood cell, everybody can probably think back to health or science class where they see a picture of a red blood cell. It's this little kind of like a donut looking thing that has a squished middle and it's round and it's typically red. There's a protein in there called hemoglobin that actually holds on to oxygen molecules.
Right.
So when they don't have any oxygen molecules on them, it's empty. Think of like a coal car on a train with no coal in it. It can carry something, it just doesn't have any on it at the moment. So that's deoxygenated blood, is blood that has blood cells with deoxygenated hemoglobin. Okay. And then when that blood cell gets exposed to oxygen, the oxygen molecules will go through the red cell membrane and kind of get hooked onto those receptors. There's typically 4 of them on a hemoglobin molecule to hold on to oxygen. And then now the protein looks a little bit different. It actually changes its shape a little bit. And it will hold on to those oxygen molecules until it gets someplace that needs the oxygen, and then it drops them off. So, I mean, the bloodstream very much works like a train that's delivering coal from a coal line to a power plant or something like that.
Right. We seem to be getting a little stutter on your side with the internet too, FYI, by the way. So I don't know. I don't know quite what that is. Maybe somebody running something else in the house. Sometimes that can also affect it. So when you talk about the oxygen, so the importance of that circulation to be continuously going through the heart is really vital, because if the blood, for example, stayed in one location, which wouldn't make any sense, too long, can I kind of imagine that the blood then is losing the oxygen content, and that makes it not good?
Yeah, I mean, that's exactly what happened. So
okay,
about, if you took a tourniquet and you didn't have an injury, just for the heck of it, decided to put a tourniquet right under your shoulder and cut off the arterial supply of your arm, if you use that tourniquet, you won't get any more blood flow to your arm, and the blood that's in your arm will lose its oxygen very quickly, and then it's useless. It's not performing any function, so the tissue in your arm won't get any oxygen, and it'll slowly die.
Oh, okay. Wow. So that circulation, reminds me when I was helping take care of my mom, that she had parts of her body basically she had really poor circulation. And it wasn't those areas that had poor circulation. They were basically dying, being a diabetic, which I have a question for later. but being a diabetic and all, it became kind of necrotic. I think, is that the right word?
Yeah, no, that's exactly right, and that's exactly the example I was going to use. Is the most typical or stereotypical example of people having problems with poor circulation is diabetics. If you look at a bottle of lotion or like a foot bath or something like that, it always says, "Do not use this if you have diabetes." And the reason for that is that if you have diabetes, you're much more likely to have inadequate circulation to your extremities, particularly your feet, because they're so far away from your body, so or from your heart. So if you get something that like a cut or a sore or some sort of damage to that area and your circulation isn't adequate, your body's not going to be able to heal that well, and you start getting worsening and worsening infections and necrosis and things like that. That's one of the reasons why, even just as a regular adult, if you break your foot, it's going to take a long time for that to heal compared to
Ah,
if you have a break someplace closer to your body, because the circulation there is typically not as good.
wow. So the circulation, which is relative to the strength of the pump of the heart, all of that is very relative. And
Yeah.
also for those people out there who are diabetic, is there something they can do to increase blood circulation, or should they be focused on their heart?
So it sort of depends. That's a little out of my area. Just as a pediatric cardiologist, I don't take care of adults with diabetes,
Okay,
and
okay.
somebody who has diabetic peripheral disease, both peripheral neuropathy. Sometimes your nerves don't work right, and that creates its own problem, or peripheral arterial disease that oftentimes goes along with there being problems with the arteries right in the heart, the coronary arteries. So
Mm.
sometimes they really can't do a lot of exercise because they're sick enough that it would be dangerous for them to potentially do that. So the real take home message for somebody who either has diabetes or is what we call pre-diabetic, meaning their blood sugar is elevated and they're kind of heading towards developing type 2 diabetes, is to follow their doctor's advice and cut out their sugar intake and do the things they do when they're still early in the disease to try to prevent it from progressing, as opposed to when you're full on diabetic that has peripheral artery disease and peripheral neuropathy. Trying to fix that is very, very difficult. It's much easier, or at least the outcome is much better if they catch that early and can try to make some lifestyle changes along the way.
Awesome, awesome. What I think is going on with your phone as well is that you might be a little far away from it. If it's possible to come a little closer, because I think what happens, your phone is the camera is trying to adjust you. That's just my guess, but right now it looks great. Looks great. Right. The other thing is, now here's a more of a lighter question. Again, it might be lighter, but it might be a very serious subject for a lot of men out there when it comes to poor circulation. And I wanted to ask you about that because I know that this is a big problem with men with ED. So how important is the circulation when it comes to that area?
So I mean, it's very important, and if you find yourself having erectile dysfunction, it certainly should be a red flag that you need to go discuss that with your physician to find out what's going on and make sure that it's not a sign of there being a much more significant circulation problem. So people who have peripheral vascular disease very frequently will also have erectile dysfunction. There's other things that can cause that, and sometimes it's relatively simple to control with the medications that you see advertisements for all the time during sporting events and things like that.
Right. Yeah.
But just like anytime anything in your body doesn't work the way that it used to, you ought to take that as a warning sign that maybe we should get that checked out. And that's men in particular are relatively famous for ignoring things
Yeah.
for a long time. It'll be all right, and that's not a good idea. Um,
Well, I mean, a friend of mine told me, a friend, was telling me about those blue pills, right, and
yeah,
things like that. And I have a theory. I have a theory that if you already have a heart condition and you take a pill like that, first of all, what does a pill like that do, like Viagra or something like that? What does it do to the heart that somehow makes it better for you in the sense of ED?
Yeah, so the action of those pills from an ED standpoint actually isn't on the heart itself, it's on the peripheral vasculature. Because
Oh,
what happens in order for you to have an erection, what has to happen is the arterioles and the arteries going to the penis have to relax to let blood flow out, and then, or to let blood flow into the organ, and then the veins constrict, so the blood that goes into it kind of gets stuck. So I mean, for lack of a better term, it's just like blowing up a pool toy. You put
Okay.
air in, the air is under a little bit of pressure, you wind up with an inflated pool toy. If you can't get air in, or in the case of an erection, if you can't get blood in, then you're not going to get an erection. And what those medications do is they actually relax the little muscles that wrap around the vessels there to help them relax, to make it easier for nitric oxide, which is it's a gas that actually works to cause vasodilatation. In pediatric cardiology, we actually use sildenafil in particular all the time in babies for a completely different reason. We use it for kids that have something called pulmonary hypertension, where
Hmm.
the vessels in their lungs are too constricted and it's too hard for the body to, or the heart to push blood out to the lungs. So you put them on scheduled sildenafil, usually 3 or 4 times a day, and it relaxes those vessels and lets the blood go through the lungs more easily. So the same thing happens when you're trying to give somebody an erection that has erectile dysfunction. You take the pill a little before you're hoping to have an erection, and it lets those vessels relax, so hopefully they'll work properly.
Okay. Wow. Good information there. That might help my friend. I'll talk to my friend, and see what's up with that. The other thing is that we kind of talk about this on some other shows that we've had. I told you about the energy drink thing, so we're not going to talk so much about the energy drink, but I do want to talk about, is there a thing of increasing your heart rate, which I think is important, I guess, having a decent heart rate and a pulse rate. But is there a difference between artificially increasing it with like an energy drink or some other type of stimulant and doing it from like actually working out?
Yeah, for sure. So, you can't, if you took two people and gave both of them a heart rate, say the resting heart rate was both 60 beats a minute, and you're like, all right, we're going to exercise, and person A is going to exercise by going for a run, and person B is going to exercise by sitting in an easy chair and drinking monsters until his heart rate gets to be the same as
Right.
the person who's running. If they both get their heart rate to 150 for half an hour, and you do that every day for a month, the person who runs, for that, to get that effect, is going to be in significantly better cardiovascular shape. The
Okay.
person who is drinking the energy drinks to do that is not going to be in any better cardiovascular shape at all. And the
Right.
difference is all the other things that exercise does for you, that just increasing your heart rate with a stimulant doesn't.
And would also be contrary with all the junk that's in energy drinks too, right? Wouldn't that
Right.
also
Yeah.
be a negative effect?
Yeah, for sure. All the other stuff. If we ignore the other chemicals, because depending on the energy drink, some of them have other types of stimulants in them. Pre-workout supplements oftentimes have things that they claim increase nitric oxide to give you a better pump, but they actually just kind of make your skin tingle, so you feel like you're getting, some sort of an
Right.
action. And then all
Right.
the sugar and the artificial dyes and things like that. Even just ignoring that, if you did it just by taking straight granular caffeine, you still wouldn't get the effect you want. But with all the other stuff that's in energy drinks, if you drank enough to do what we just said, you'd be taking in probably an extra 500 or 600 calories of fuel
Wow. Yeah.
a day, depending on which energy drink you took. So yeah, it's definitely not a good thing. And the problem with stimulating your heart in that effect is the the substances in the energy drink that make your heart rate go up also can increase what's called the automaticity of your heart cells. So they make it
Wow.
more likely that you would have dysrhythmias. And that's the problem that people have had with energy drinks, is that when you kind of flog your heart and make the heart rate go up significantly without all the other good things that happen with exercise, you're more likely to have rhythm problems, and you're more likely to push your heart rate beyond where your heart is happy functioning. So if you have some atherosclerotic heart disease and your coronary arteries are a little clogged, and you drink a bunch of energy drinks and get the kind of stimulant effect from that, that can be a problem. And if you have an inborn predilection towards a rhythm problem that you're not aware of, and you take in a bunch of stimulant, that can also cause a problem.
Yeah, that was one of the things I was going to ask you about was the AFib, which is really popular. I hear a lot of people having heart conditions have to deal with that arterial fibrillation,
Hmm.
and you know that is something kind of what you just said, that not only with the energy, but maybe they're not doing energy drinks. Perhaps it's just something that happens. What is it in the heart that happens that causes AFib?
So atrial fibrillation and atrial flutter, which are both related to each other. The atria part of that, we were talking about through the heart. I said that it comes back from either the body, the lungs, it goes to a top chamber, and then gets from the top chamber into the ventricle, the bottom chamber that does the actual pumping work. Those top chambers, the sort of collecting areas, are called the atrium. And if you live long enough, what happens, and I mean, this, it's really, if you go to like a nursing home and look at a bunch of people who are in their 90s, you would find a substantial portion of them have atrial fibrillation or atrial
Mm,
flutter. But over years and years and years, as your atrium stretch just a little bit or get a little bit bigger and the cells get a little bit older, you can sometimes get issues where when the heart tries to contract and the electricity goes through it, it can set up short circuits up in the atrium. So if it sets up a big short circuit, so the whole atrium contracts, but it's kind of whipping around the atrium in a circle. Your top chambers will beat really fast,
right.
usually like 300 beats a minute or so, and
Wow.
then some subset of those, either every second or every third beat, will go down to the ventricles. But your top chambers are kind of flying. That's what's called atrial flutter. I mean, if you look at the heart, it literally looks like the atrium are fluttering because they're beating so fast. And then atrial fibrillation, there's reentrant circuits. They're really small. Atria are what they call quivering because that are contracting the whole time. So you never see the atrium squeeze like this. They just kind of are shaking um, at a very, very, very fast rate as well.
Hmm. Hmm. That's interesting. You know what? I'm going to be one of the smartest person ever if I keep doing my show for the next 10 years or so like that. I'm going to know a little bit about everything. I believe. I thought I kind of put myself there anyway, knowing a lot about a little bit about a lot of things. But I really feel like I'm getting truly educated with my show here. You know, one of the things that I came across while I was doing a little research for the show, as I do, is about how fast the heartbeat of a newborn is compared to an adult. Why is that?
So across animals, there's pretty much a pretty consistent inverse relationship between the size of the animal and their heart rate. So the smaller the animal, the faster their heart rate. So like a hummingbird heart is ungodly fast, an
All
elephant's heart is
right,
super, super
yeah.
small or super, super slow. So it has to do in humans. It has to do a little bit with body surface area versus the size of the heart itself. So think of a newborn baby, and you see them reaching up with a little fist. Their heart is about the size of their fist. So
Right.
they've got a heart that's about the same size. If you've ever cleaned like a Cornish game hen, an itty bitty little acorn sized heart. So in order for a organ that's that relatively small and has that small of an end diastolic volume to create the amount of blood flow it needs in a minute to create the
Ah.
cardiac output, it's got to pump faster. It's just like if you're trying to pump up a bicycle tire with a small pump, if you're going to get it pumped up in a short amount of time, you got to pump like crazy. Where if you have a bigger pump, you
Right.
don't got to pump it as much because each time you get more stuff. And as an adult, your heart is still, it's in most males that are in decent shape, your heart's kind of the size of your fist with your other hand laid over it. So it's a little bit bigger compared to your body surface area, but the relationship of your left ventricular diastolic, how big your left ventricle gets to your body surface area, it's a closer number. It's not as small compared to the size of your body.
Right. Well, we talked about, and that's about the fast heart. But on the opposite side of that is something that they told me that I had when I was training and in great shape. They said I had athletic heart,
Hmm.
right? They said because my heart rate was actually slower than maybe the average person. Can you expound on that a little bit?
Yeah, sure. So that's something that it's interesting. Like when you go to, like, say, your kickboxing tournament, we're doing the intake physicals for the 200 people.
Right.
I can, it's not an exact science, but if you
Right.
caught all 200 people when they're calm, cool, and collected,
Right.
so the fact that they may have just cut weight or they're nervous about fighting tomorrow kind of screws us up a bit. But if you
Right.
caught them truly at rest, you would be able to get a reasonable idea about what sort of cardiovascular shape they're in based on their resting heart rate. When you really exercise and do a lot of cardio and you're kind of forcing your heart to make changes so that it can carry more blood or more oxygen through the bloodstream out to the body, it literally becomes more efficient. So if you look at people who have really, really good cardiovascular fitness, their resting heart rate is usually really low. I use Lance Armstrong as an example, and obviously he was doing some other stuff besides just cardio,
Yeah.
the heart rate lower. The EPO and the other drugs and things would have an effect with that. But anyways, if you take true top caliber cardio athletes, so swimmers in particular, fight sport athletes, rowers, things like that, their resting heart rate can be as low as the high 20s or low 30s because their heart is so efficient. When it pumps blood, it's able to pump more blood and pump that blood further than it is in your more typical American couch potato Cheeto eater who doesn't do a lot of cardio exercise.
Right.
That's one thing a lot of people who are trying to get into shape will actually follow, and it's something I recommend people who are trying to get into good shape is your early morning resting heart rate for a number of reasons. So like I'm injured at the moment, so I'm not doing anywhere near as much training as I normally do. And when I wake up in the morning, my heart rate is in the high 60s, where normally it's in the low 50s. So I
Mm.
know if I go out and try to run, I'm not going to put in the times that I would normally be able to get when I'm in
Right.
better shape. But as I start training more and more and get back into grappling consistently and start getting back into the kind of shape I need to be in to compete, my resting heart rate in the morning will start trending back down into the 50s where it normally is. And
Mm.
that's a
Interesting.
very good example that you're in good cardiovascular shape. And the other reason why I think the early morning heart rates are helpful is everybody talks about being concerned about overtraining. And I think we talked about this in the
Yes.
past. I'm not really a big fan of the term overtraining. I use the term under recovering because that's
Right.
really the problem. It's not that you're necessarily working too
Right.
hard.
Right.
You're not giving yourself a break. But what happens is if I start checking my morning heart rates and it's, 52, 54, 52, 50, 54, and then all of a sudden one week it's 58, 64, and it's significantly higher than it was. What that means is when you wake up in the morning, your body is not recovered. And
Ah.
if you get that a day, or especially if you get it 2 days in a row, it can be a very good signal that maybe we ought to have an active rest day and not, go out and be doing a whole bunch of rounds of hard sparring on a day that your heart rate is already up because you're putting yourself in potential danger. So a lot of high level athletes and a lot of fight sports folks use that early morning heart rate or heart rate trends, especially now it's easy to get that with your iPhone or your Apple Watch. They can use those trends to see that they're not as recovered as they should be and use it as a reason to take a day to recover and then get back after it instead of pushing themselves and winding up getting hurt.
Yeah, I don't think enough people, athletes, pay attention to the heart. I really don't. I don't think they pay enough attention to taking good care of it, not understanding how it correlates with the rest of their activities. Does that make sense?
Yeah, no, I think you're exactly right, and I think people in general, especially the age of people who are doing fight sports, which 18 to
Yeah.
late 20s is kind of the biggest bulk of people who are doing that. Everybody's in that sort of Superman or Wonder Woman. They know they're in great shape. They're in better shape, they think, than 99% of the population, and nothing hurts, so they figure everything is going okay.
Right.
And then that's when you don't go to your doctor for 5-10 years in a row and you don't realize that you actually have high blood pressure and your hemoglobin A1C is high as a sign of prediabetes, your cholesterol level is really high, and then all of a sudden something happens. You pass out while you're training, you start getting chest pain, and you go to your doctor when you're in your late 30s early 40s and you find out you have atherosclerotic heart disease and
Right.
diabetic peripheral neuropathy, and now you're trying to fix things that are well along the way of the disease process. It's like trying to replace a rusty body panel as opposed to keeping the salt off your car for 10 straight years. It's
Right.
way harder to fix the problem once it's there than it is to see the warning signs and try to make some changes along the way.
Wow. Good info. Okay, so changing gears for just a minute here. When a person has a heart attack, I know there's a lot of different causes of it, but what actually happens, when you think about a heart attack,
Hmm.
it's like, as fighters, we attack. What's attacking the heart?
So when people use the term heart attack to describe a bunch of different things. So I'm going to narrow the term a little bit. When used correctly, the term heart attack is sort of the layman's term for what's called a myocardial infarction. So that the what's going on is included in that term. So myocardial is the heart muscle, myo muscle, cardial heart. So it's heart muscle, and then ischemia or myocardial dysfunction. The ischemia means that you're not getting enough blood flow to the heart. So a heart attack literally means that you're not getting enough blood flow or enough oxygen to the heart muscle, and the heart muscle starts to die. So
Oh,
typically that happens, the average middle-aged person. So, me, if I suddenly clutch my chest and start having a heart attack, what's normally going on is that for years and years and years, you've had high cholesterol and you start getting little plaques of atherosclerosis actually in the coronary arteries, the little arteries that bring blood flow to the heart muscle. And then something happens to make one of those plaques rupture, and you wind up getting a blood clot that forms on that rupture, and that blood clot occludes the artery very quickly. So it's like you kind of reach in with a pair of tweezers and pinch one of those arteries closed. So just like when we talked earlier about putting a tourniquet on your arm muscle starts to necrose or starts
right.
to die. That's what happens to your heart muscle very, very quickly. As soon as you don't get enough oxygen to your heart muscle, that heart muscle starts getting really sick and starts to necrose and die. And that's what causes that crushing chest pain that people talk about when they get a myocardial infarction. So it's literally death of the heart tissue.
Right. So that's the attack. The attack is basically lack of, as
Right.
opposed to more of. Like you beating on somebody. No, don't beat on them. All right. But so it's kind of the opposite of attack, I guess, right?
Yeah, I guess so. I think that people call it a heart attack because it's kind of like something is damaging the heart, and that's
Right.
so true. But yeah, right. It comes from a lack of blood flow, and then you hear about there's been a couple of fighters in the past decade that have had heart attacks either during training or something like that. And when it's a younger athlete, the heart attack is usually not from cholesterol. It's usually from some sort of intrinsic problem with the heart. So some people have a problem called hypertrophic cardiomyopathy where their heart muscle is not normal. So
Right.
it's way thicker than it's supposed to be. And when you exercise, that extra thick heart muscle demands more oxygen and it makes it harder for the left ventricle to pump blood out to get it to the heart muscle. So sometimes it can suddenly cause you to not to get any blood flow out of your heart and your entire heart starts to die. Or they can have a problem with their coronary arteries where they're not built normally or they course someplace like between the pulmonary artery and the aorta. So when you exercise, they literally get physically pinched closed by the arteries. So there's some other things that can cause a heart attack to happen besides just atherosclerosis. But the final pathway is still the same. It's because you're not getting enough blood flow to the heart muscle.
So the thing I'm trying to, of course, everyone starts calling me about right now. Yeah, but I guess they're not on Facebook, because certainly, the thing I'm trying to differentiate now is the heart attack and the stroke.
Mhm.
Now, is the stroke more in the brain? Is it more of a brain thing, and the heart attack is more from the heart? How do they
Yeah.
how do they relate with each other?
So what you just said is exactly correct.
Okay,
A heart attack is something that occurs in the heart, and a stroke is something that occurs in the brain. And actually, neurologists are trying very hard to change the name stroke to brain attack. And there's a number of reasons for that, but that's kind of catching on. So medically, people usually will say a brain attack, and it's the
mm,
same. And the reason for that is it's the same type of process. What happens with a stroke is something occurs in the brain, so your actual brain matter isn't getting enough blood flow. And in general, there's two major divisions of strokes. There's what they call hemorrhagic strokes and ischemic strokes. A
mhm,
hemorrhagic stroke means something happens to one of your blood vessels and you bleed into your brain. And because that blood vessel is bleeding, it changes the pressure and makes a spot that can't get enough blood flow. And then
mm,
an ischemic stroke, something happens so that you have one of those vessels get clotted off or blocked by something. It can either be atherosclerosis, or we had talked about atrial fibrillation and atrial flutter in the heart recently. One of the reasons why atrial fibrillation and atrial flutter is so dangerous is when your top chambers are beating really fast and not squeezing really
right.
well, blood tends to pool in the atrium and they can actually form little clots. And if one of those little clots forms on the left side of the heart and gets pumped out and goes to the brain, it can occlude one of the vessels going to the brain, and that would cause an ischemic stroke.
Right,
So,
but I'm sorry, but along with that, and I put that question up a little early because I wanted I have a friend of mine, and by the way, Mahmoud, I hope your mom is going to be okay. Who just suffered a stroke and had some paralysis. I want to know a little bit about what goes on in the brain. In other words, when you say that certain parts of the brain are not getting blood function, so basically that cell is dying, and is that why they lose, like get certain paralysis or lose speech or something like that?
Yeah, that's exactly right. In what happens from a stroke depends entirely on what area of the brain it is that's affected. So if you have a stroke that affects your motor cortex on the right side of your brain, you'll see problems with the left side of the body. So someone who's had from a stroke, half the body is paralyzed. It means that the motor cortex on the other side of the brain was affected. And if you have a stroke that affects your speech centers, you'll have problems with speech. If it affects your memory centers, you'll have problems with your memory. If it affects your frontal cortex, you'll see personality changes and
Hmm.
things like that. But it comes from actual both physical and biochemical damage to the cells in the brain.
I had one of my nieces actually had a stroke. And look, I don't know unless she's a great actress. I mean, I don't know. But when she kind of was recovering, she picked up an accent. Have you
Mhm.
ever heard of that?
Yeah, it's actually well described.
Oh,
I think it's
wow.
yeah, it has to do with the brain is a weird place, and I have a couple of my physician friends who are neurosurgeons and neurologists, and if you're watching this, I apologize in advance because the brain is an area that is just not my thing. I'm a plumber and electrician. I like things I can put my hands on and like see
Right.
how they work. Where the brain is like a computer. It's when you look at the brain, you can't figure out what it's doing because it's all electrical and in chemical, but there's a number of different kinds of brain injuries that have caused people to pick up or lose all sorts of skills. There's people that have gotten brain injuries and have been able to play the piano afterwards where they couldn't before. There's people that have gained or lost the ability to speak entire languages. That's not super common, but it happens. And there's definitely people who have gained and lost accents depending on what area that it affects. We think that the accent is probably related to change in control of the tongue, so that you like develop sort of like a whistle
Ah,
something that sounds like an accent more so than like if I have a stroke, it's unlikely I'm going to suddenly sound like I was born and raised in Brazil. But you might develop a speech impediment of some sorts that sounds similar to that sort of accent, but it definitely has happened, and it's not clear exactly why.
so it's like so if I hear you correctly, you're saying that it's like a motor, one of your motor skills kind of gets a little thrown off. Like if your tongue, if you have the stroke affected your muscles or whatever in your tongue, you would now use it a little differently, so it comes out sounds a little different.
Yeah, I think that may be part of it in some cases, and in other cases, they may
Wow.
actually have an accent because when their brain was sort of relearning how to speak, because I don't know if you've ever been around somebody who's had a stroke and was what they call aphasic. They couldn't talk after the stroke,
Right.
and then regained their verbal skills.
Yes.
When you regain those verbal skills, there's no reason why you wouldn't potentially develop an accent, particularly if the person who's working with you the most has an accent of some sorts, because that's what's going to be your feedback to speak in that direction. Just like if you have a friend that's from Mexico City and they speak English with a Mexican accent, and they have a child and they teach that child only English, but he doesn't ever get exposed to other kids that speak American English, they're probably going to speak English with a Mexican accent because that's the only way they've ever heard it. And then once they go to kindergarten and get around kids that speak American English, they're probably going to lose that accent because they get feedback, somewhat differently. So when
Wow.
you reacquire your language, there's an opportunity to have an accent sort of inserted into that as well.
What are some of the best forms of recovery for when a person has a stroke?
So the short answer to that is it depends. It depends on the kind of stroke they had, how significant the damage was, and what areas were damaged, and then the recovery from that's a science all in of itself.
Okay, so I mean, but would you recommend a person exercises more after a stroke, or should they rest and kind of rebuild?
Initially, rest would probably be the most important thing, but again, it depends entirely on what caused their stroke and how severe it was. In particular, the difference between what somebody would recommend for somebody who had a hemorrhagic stroke and had hypertension and had like a Barry aneurysm burst
Right.
versus somebody who had a fib and had a thrombotic stroke, their recovery is going to be completely different because the risk of having a rebleed would make exercise a bad idea until they can fix whatever caused the bleed in the first place. Whereas if you
Wow.
had a fib and a hemorrhagic stroke and you go on a blood thinner, then exercise is probably going to be a good idea much sooner.
Okay, I want to do a quick shift right here on about medications. I know that there's a lot of medications and everything that can affect, like the liver. People always warn you about acetaminophen and things like that, that you take that. If you take too much, it's not good for your liver. What kind of medications would you say that you might take that would be bad for the heart?
So there's not too many that you would just like over the counter medications that would
Okay,
be directly bad for your heart. The biggest class of medications that are an issue for the heart are antidysrhythmics, which ironically, oftentimes, so people who have a rhythm problem and have to take a medication to try to keep their heart from going into a funny rhythm, those medications can also be pro-arrhythmic in other ways. So if you don't take them correctly, or sometimes you just have a reaction to it, it can make you more likely to have an arrhythmia. And then chemotherapeutic agents are the other big one. People that have cancer, especially a child, get a certain class of medications for their cancer. That class of medications will often damage their heart and make them develop a myopathy where their heart doesn't squeeze as strong as it should afterwards.
right. Okay, okay. So for the most part, though, they can give you something obviously to help the heart, but it's not anything like taking too many ibuprofens or whatever that wouldn't necessarily affect the heart. Or yeah,
Yeah, typically not. Those, the most of the over-the-counter medications that can cause problems are usually going to cause either kidney problems or liver problems. You can from stimulants, so like your decongestant medications or legal
right.
or illegal stimulants, you can cause problems. And caffeine fits to the legal stimulant side of that. Just like both, you can cause problems from that standpoint. And then there's also some medications. It's a pretty extensive list that can affect the way your heart repolarizes and can cause some prolongation of something on your EKG called your QT interval.
Mm,
Particularly if you have a family history of long QT, there's medications that those sort of people shouldn't take. Azithromycin, which is you probably know it as a Z-Pack. People get a cold and they
right.
find out they have a sinus infection. They go,
A
they get a
lot of
5 day
medicine.
Z-Pack.
Yeah.
Yeah. So there's issues where people that have taken Z-Packs have had problems where they didn't know they had a predisposition to having long QT. Took a
Mm,
Z-Pack, it made their QT interval longer, and they can develop some cardiac problems from that. But
wow.
those instances are relatively infrequent, and that's something that your doctor should be talking to you about before
Okay.
using those kind of medications, anyways.
All right. So we found out all the things, a lot of things about the heart. Obviously, there's so much more, such a complicated muscle in your body. But let's talk a little bit about the health right now. Let's talk about what kinds of food that we can eat and the type of beverage that we should be consuming to make our heart stronger and better.
Yeah, so if you got 100 people who considered themselves to be experts in diet together and asked that question and then walked out of the room and came back an hour later, you would almost certainly be walking into a riot because there's just really there's no great consensus as to what the proper diet is, and you can see that. I don't know how closely you follow some of the more popular sports folks that they get interviewed, and they say, hey, what do you do for your diet? And there's people that are vegetarian, there's people that are vegan, and then on the other end of the spectrum there's a growing number of people who follow the carnivore diet, or there's some people who follow an exclusion diet where they literally eat
Right.
nothing but meat at all. They don't
Right.
eat and salt, and both people will tell you that the diet has completely changed their life.
Yes.
Um, in general, most physicians or most medical dietitians would recommend a diet that's kind of tilted towards plant-based. So there may be meat in it, but they would recommend that you limit your red meat intake because of the cholesterol and
Mhm.
saturated fat that goes along with red meat, and eat as little supplementation as possible. So you want to try to get your vitamins, your minerals, your fiber, your nutrients, and protein from plants and animals, as opposed to a pill that you have to take.
Okay. Yeah, I was in the store once. I never forget. I was talking to this lady about health and fitness, and about losing weight and all this. She's like, "Why do I need to go and work out and lose weight when I can just take a pill?" I mean, that mentality is just dangerous, is it not?
Welcome to America. Yeah, that's a
Right.
common question, but no, it's exactly true. And everybody kind of leans in that direction, because even athletes, why should I lift weights all the time when I can just go on steroids and get more muscle that
Yeah.
way? And obviously steroids wouldn't mean you wouldn't have to lift weights, but everybody's always looking for the magic something to kind of to help them out a little bit. And we as humans run into trouble all the time trying to cut corners by.
So the actual process of exercising, the fact that you're getting your cardio, you're running, you are jumping rope, beating the bag, or whatever. I want to get kind of like intricately into what exactly does that exercise do to the heart that makes it good for you?
Yeah, so a couple of things. So, in particular, when you're doing sort of medium intensity, longer term cardio, so your road work, you're out, you're running 5 miles or something like that. What you're doing is you're getting your heart to work not as hard as it can, but harder than normal, and
Ah,
having to pump more blood, and it actually will cause your heart to stretch a little bit, particularly your left ventricle, and it will increase the heart's stroke volume, and will end up increasing your goal for cardio exercise is to increase something called your VO2 max,
mm,
meaning the ability of the VO2 max is defined as your body's maximum ability to deliver oxygen out to your tissues, because that's the goal of your heart and lungs, is to get as much oxygen as possible out to your muscles. And the
right.
higher your VO2 max, the more exercise you're going to be able to do, still being aerobic without crossing into anaerobic, where you're creating lactic acid and getting sore and things like that. So for cardio exercise, your goal is to get your heart into better shape so it's able to pump more strongly and pump more blood each time that it squeezes, so that you can deliver more oxygen out to the tissues. And then for people who are doing exercise like grappling, or doing sports like grappling, wrestling, kickboxing, boxing, where you have a significant aerobic pardon me, a significant anaerobic
Anaerobic, yeah.
component as well. You There's ways by doing things like high intensity exercise, where you're doing like Tabata intervals, where you seconds, take 20 seconds off, and go hard as you can for 20 seconds and take a couple seconds off. So you see that in boxing gym. I'm sure you do that all the time yourself. At the end of a 3-minute round, they go, and you've got 30 seconds where you're supposed to kick and punch the bag as hard as you can. At the end,
Right.
your arms and your legs feel like they're filled with lead, and you're breathing super hard. That's anaerobic metabolism, because you're working so hard, your body can't get enough oxygen out to the tissues. And by doing little sprints like that, where you're really pushing yourself anaerobically, you can actually increase your anaerobic fitness as well. And particularly for fight sports folks, you kind of need both of those systems. I'm sure you've seen the example we use in BJJ all the time.
Right.
We always will have somebody come in who's like a marathon runner, who's in super good shape, has no
Right.
body fat whatsoever, and they're thinking, I'm going to have no problem
Right.
grappling with these guys and grappling with them for 5-10 minutes straight. And within 30 seconds, they're sucking wind like crazy.
Right.
They can't figure out why they're so tired, and it's because they don't have the anaerobic part of their metabolism. So you kind of have to have, depending on what sort of sport you're doing, you kind of have to
Mhm.
have both of those. But particularly for the sport you're in, the sport you and I are involved in and love, any of the fight sports, you kind of have to have both parts of that. So when you talk to the people who are at the top of their game and have the best gas tank, and find out what they're doing for their fitness, they're
Right.
usually doing some medium intensity long term exercise like the road work or swimming or riding a
Wow.
bike for a period of time, and also doing some sort of high intensity fitness where they're doing short bursts like Tabata intervals or bag work or running the stadium stairs, that kind of stuff, to do their anaerobic metabolism as well.
Wow, 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 wow. Every time I have you on, it is like an encyclopedia. It is so much great information, everything. Give me your final thoughts on overall heart health, and what would you recommend to fighters and people, just general public?
So, fighters in particular, and also the general public, that age range, the thing that I think is most important for them is to avoid that Superman Wonder Woman syndrome. Don't assume because everything feels like it's okay that you don't need to have a physician that you see at least once a year to be looking at your blood pressure and your numbers of your labs and things like that to look for potential health problems that could come up in the future, because the preventative medicine is much better for you than dealing with the problem.
Mm-hmm.
Having brakes versus having airbag. My car has both. I would much rather use the brakes to not get into the accident in the first place than to hope that my airbag works really well when I get into the accident. So I
Right.
see a lot of folks that come to that are training a lot in fighting, particularly in MMA, that don't have any insurance, don't have a primary physician, and the only time they see a doctor is before their fight. And I seeing a doctor 2 or 3 times a year for 2 minutes before your fight, where we're just listening to your lungs and heart and making sure there's nothing going on that presents an immediate danger to you to fight, is different than having a primary doctor that you see every year that's able to follow your blood work and knows family history, can look at your hemoglobin A1C and your blood pressure when you're not just about to get to a ring and fight somebody. So that would be my main thing, would be to take your long-term health seriously and make sure that you have a doctor, or do everything you can to see a doctor regularly, so that when you turn 35, 45, 55, 85, you don't find out the hard way that you've had high blood pressure for years and you get it diagnosed after
Right.
you've had a stroke, or that you've had high cholesterol for years and you find out after you've had your heart attack.
Well, I think that is some great advice, great information, and I'm sure the people who will eventually see this recording will, if they take heed, they're going to be healthier, no doubt about that. Before I let you go, though, there's something coming up on March the 20th and 21st in Myrtle Beach, South Carolina. And I always like to, to have you make a comment about that event. You are the chief physician there. Give people an idea about what the ICAF Spring Classic is all about, and your perspective on it from a physician standpoint.
Yeah, and I think I've said this to you before, and I'm saying it not just because we're talking face to face, but that's by far one of my favorite events to go to every year. The Spring Classic and the Fall Classic. It's a really, really well run kickboxing tournament. It's really enjoyable for me, particularly the gyms that typically come every year, and you get to see the same folks, 2, 3 years in a row, and watch how they progress their skills. And my favorite part about that tournament is because you have a pretty good stable of officials, the referees, the corners, the people who are sanctioning it, do a really good job of keeping that event safe. They let people get out there and compete, but if a fight's if a fight's going on between two people and it's very clear that one person just isn't up
Right.
to snuff with the other one, they don't wait until that person gets injured by the better fighter. They'll stop the event,
Right.
and it's really been very, very well run. I mean, this is going to be what, the 7th or 8th year
Well,
that they've
it's
been going?
actually the 10th one.
The 10th. Wow, time
Right. This
flies.
is the fourth spring. This is the fourth spring. But then we started doing a spring and a fall. So it's our
Yep,
10th tournament since I've been back in this area.
great. So in those tournaments, and I've been there for every single one. You and I were there back when we were south of the border.
Exactly. That was my first
Yeah,
one.
but we haven't had any substantial injury during that, and that's you
Fingers crossed.
figure, fingers crossed, and it's a dangerous fighting somebody's a dangerous
Yeah.
proposition. So I mean, injuries may happen, but as far as there being a significant dangerous injury that occurred or a
Right.
life altering thing, we haven't had that happen, and I think that's a real testament, not so much to the medical staff, but to
Yeah.
the matchmaking. You're not putting a 230-pound guy with 420 fights
Right.
in against somebody my size who's
Right. Right. Right.
you do a really good job matching. The referees do a great job of keeping people safe during the events, and then having like the PKB to get people some experience without having to worry about getting knocked out, and they're not going 100%. The safety equipment is top notch, so it's really a well run event.
Right. Well, having the PKB there is a big part of it as well, and we will certainly be having that there as well as the PBSC, and because, as you said, it is a great incubator for everybody involved and stuff. But I just want to thank you for taking the time out today to educate us on the importance of good heart health, because I think all of us need it, especially athletes and fighters and all. And I think you are a true asset to the sport. And I certainly appreciate you, not only for today, but just everything you do for us.
Oh, thanks, Johnny. I'm glad to help out.
All right, sir. We'll be talking to you real soon. Dr.
Right.
Lucas in the house. Thanks, sir.
Take it easy.
All right, bye-bye. All right, ladies and gentlemen, there you have it. We were speaking there with Dr. Jon Lucas. He is a pediatric cardiologist there, just doing a great thing for our sport, ladies and gentlemen. I tell you, look out for him. He's going to be doing even bigger things in years to come. Just want to remind everyone again about what we're doing, all the events that we have coming up with the IKF Spring Classic in Myrtle Beach. Registration is going on right now. Remember, there's going to be a big condensing going on, a large amount of condensing going on after Monday. So if you see a division there with one person in it, if you want to register and you're considering it, you want to go ahead and get registered right now at akpromotions.org. And again, yes, we will have the PKB there and the PBSC tournament there as well. So I'm hoping that you guys will go ahead and get registered for this great event. All right, everyone. That was a long show today, because I'm so long-winded. We want to, again, thank Dr. Jon Lucas for being on the show today with great information about the heart. I hope you will take some time to check that out. Always, we want to thank our sponsors, our Blackout Fights at blackoutfights.com and Eastern Offset Printing in Atlantic Beach, North Carolina, for all they do for us. Check us out also on YouTube. This will be uploaded to YouTube at Johnny Davis Live. Also on Instagram, we have our PKB_kickboxing there. And be sure to like our AK Promotions page on Facebook. Look, guys, I want you to always respect each other. Forward march. This is Johnny Davis Live, and I'm checking out. Talk to you soon. Bye-bye.